Welcome to the Sunshine Nutraceuticals podcast with your host, pharmacist Michael, where you learn everything about happy, healthy living. Now, here's your host, pharmacist Michael.
Today we're going to talk about the gut-brain axis and whether it's possible to treat mental health disorders by altering the bacteria in the gut. I'm going to go over what the gut-brain axis is and whether the drugs we use to treat psychiatric disorders make patients worse by altering the bacteria living in the gut. There have been many articles and studies published recently discussing the possible connection between the microflora of the gut and the progression of neuropsychiatric disorders. The bacteria in the gut are affected by many factors, including age, diet, exercise, health, and genetics. Medications can also alter gut bacteria. I'm going to try to explore the possible effects of the gut microbiome on various psychiatric disorders. So what is the gut-brain axis? The gut-brain axis is a network of nerves, hormones, and immunological factors connecting the central nervous system to the gastrointestinal tract. It appears that the gut flora are involved in this system. An imbalance of the function and composition of these intestinal bacteria is associated with many disease states. The microbes in the gut contain genes that perform metabolic functions. The metabolites resulting from these reactions can produce local effects on the GI environment or gut wall. These microbial metabolites may also be absorbed into the systemic circulation and exert their effects on other organs, including the brain. It is now known that there is bidirectional communication between the gut and the brain. This communication network is known as the gut-brain axis. Altered microflora of the gut has been associated with depression, other mood disorders, and neurodegenerative diseases. It is known that patients with GI diseases often suffer from mental health issues. We also know that approximately 1/3 of patients with irritable bowel syndrome, or IBS, have depression. In patients with functional gastrointestinal disorders, 36.5% have comorbid psychiatric disorders. The most common of these are general anxiety disorder and panic disorder. Psychiatric medications are known to disrupt the microbiome of the gut. Second-generation antipsychotics such as olanzapine change the balance of intestinal bacteria, leading to obesity. Antidepressants such as selective serotonin reuptake inhibitors, or SSRIs, may inhibit Staphylococcus and Enterococcus growth. The Belgian-Flemish Gut Flora Project found both benzodiazepines and antidepressants affect microbiology. The classes of non-antibiotic drugs that have the highest antimicrobial activity are antidepressants, antipsychotics, and benzodiazepines. The drugs that we use to treat these psychiatric disorders may be making the conditions worse by altering the composition of the gut flora. It may be possible to treat psychiatric disorders with living microorganisms. The goal would be to reestablish the healthy flora in the gut, resulting in an improved gut-brain axis relationship. This is a difficult subject to study because once ingested, the living organisms are subjected to many negative environmental factors, including the digestive enzymes, competitive microorganisms, and pH changes. Despite this difficulty, studies have been done, resulting in positive outcomes. What does the gut-brain axis have to do with autism? Autism spectrum disorders are developmental disorders that affect communication and behavior. This is known as a spectrum disorder because there is a wide variety of symptoms involved. Patients with autism have a difficult time communicating, may not respond to their name, and often do not find enjoyment in the activities that others enjoy. They may also display repetitive, stereotyped behaviors. The exact cause of autism is not known, but children with ASD often suffer from GI symptoms that correlate with the severity of the disorder. Several studies have reported altered gut bacteria in patients with autism. A treatment protocol using a fecal transplant was administered to 18 children with ASD ages 7 to 16 years. The protocol started with 2 weeks of antibiotics, followed by a bowel cleanse. The children were then given an extended fecal microbiotic transplant, using a high initial dose followed by daily maintenance doses over 7 to 8 weeks. At the end of the treatment, there was an 80% reduction of GI symptoms as measured by the gastrointestinal symptom rating scale. This including a significant decrease in abdominal pain, indigestion, diarrhea, and constipation. These improvements were still evident 8 weeks after treatment. The behavioral symptoms also improved significantly and also remained 8 weeks post-treatment. This procedure seemed to be effective for both ASD symptoms as well as GI symptoms and continued long after treatment was completed. What about bipolar disorder? One study showed that patients with bipolar mania were twice as likely to have taken a recent course of antibiotics. It has been suggested that treating bipolar patients with probiotics could help reduce hospitalization. A small study found that treating acutely manic patients with probiotics led to a decrease in the readmission rate. Dr. Faith Dickerson randomized 66 patients to receive a probiotic capsule or placebo for 6 months after hospitalization for mania. The probiotic or placebo were given in addition to a regular medication regimen. Of these 66 patients, 24 or 73% required rehospitalization, while only 8 or 24% of the probiotic group was hospitalized. The probiotic patients who were admitted also had a shorter hospital stay than those treated with the placebo. The probiotics used in this study were Bifidobacterium lactis and Lactobacillus rhamnosus. Now let's talk a little bit about psychobiotics. What is a psychobiotic? Psychobiotics are substances that alter the bacteria of the gut. These may be live bacteria, which are probiotics, or prebiotics. Prebiotics are compounds that change bacterial composition or activity when fermented in the digestive tract. You can think of a prebiotic as food for the bacteria in the gut. Probiotic 40 by Sunshine Nutraceuticals is a premium blend of 4 different probiotics. It also comes with MacTrek bypass technology, so it will bypass the stomach acid. Some probiotics simply get destroyed by your stomach acid, but Probiotic 40 has the MacTrek system, which will bypass the stomach acid. You can get yours at sunshinentc.com, and if you use the coupon code PODCAST, PODCAST, all one word, you will get 10% off your entire order, and shipping is always free within the United States. In a study of 55 healthy volunteers, subjects receiving either fermented milk containing Lactobacillus casei shirota or a placebo for 3 weeks. The study subjects falling into the bottom third of the mood score showed significant improvement as compared to the placebo group. There were no overall changes in mood in this study, which may suggest lactobacillus has a ceiling effect. In other words, people who are already relatively happy may not have an increase in mood after ingesting the probiotic. It is important to note that not all studies have shown benefits regarding probiotics. A recent review found little evidence of positive outcomes from these substances. The gut-brain axis is a fascinating topic that deserves much more research. I believe we can all benefit from eating a healthy diet, exercise, and possibly probiotic supplementation. The evidence suggests that gut bacteria are vital in helping to develop the brain at a very early stage of human development. It is also evident that many of the medications we use to treat mood disorders such as depression, anxiety, and bipolar disorder have an effect on the microbiome of the gut. In the future, we may be able to either successfully treat these disorders with specific bacterial agents or supplement the healthy flora destroyed by the medications we employ to treat these maladies. I do know that I benefited from eating a whole food diet during my Whole30 experience. My mood improved, I slept better, and was more alert and happier in general. I can't be sure this has anything to do with the microbiome in my gut, but it is certainly possible. I hope you have learned something from this podcast. If you have any questions, always feel free to reach out to me. Remember, you can always reach me at sunshine.nutraceuticals@yahoo.com. You can shop our store at sunshinentc.com. Have a great day, everybody.
Thank you for listening to the Sunshine Nutraceuticals podcast. Visit us today at www.sunshinentc.com. Have a happy, healthy life.